first step in getting a medical marijuana card is actually visiting a doctor and um, you know, telling them your problems, your disorder. If you have chronic pain or nausea or AIDS, then you're eligible for a card. Then you're going to want to talk it over with your doctor and have it be known that you're using medical marijuana for medicinal purposes only. Then you're going to fill out a form with your doctor and submit it to the Michigan Department of Community Health, and within 15 to 20 days your card should arrive in the mail. In many countries, marijuana is illegal, although it is decriminalized. Countries include Canada, Mexico, India, parts of Europe, Australia, Russia, and several of the United States. Doctors and nurses have seen that for many patients, cannabis is more useful, less toxic, and less expensive than the conventional medicines prescribed for diverse syndromes and symptoms, including multiple sclerosis, Crohn's disease, migraine headaches, severe nausea and vomiting, convulsive disorders, the AIDS wasting syndrome, chronic pain, and many others.
Medical marijuana has the potential over years of use to cause more known harm and health complications in addition to the patient's original condition.
Like all medicines, marijuana has its drawbacks, particularly in smoked form. It's not a panacea. I support research in safer delivery systems, such as low-temperature vaporizers or inhalers, which offers the fast action of inhaled medicine without the irritants of smoke found in smoke. Still, I have seen in my own studies that marijuana is less toxic than most pharmaceutical drugs in current use, and is certainly helpful for some patients, including those with wasting syndrome, chronic muscle spasticity, and tractable nausea.
The constituent part of marijuana, which is useful in the treating of HIV, wasting, nausea associated with chemotherapy, and potentially pain, is available to physicians to prescribe in the form of Marinol.
From working with AIDS and cancer patients, I repeatedly saw how marijuana could ameliorate a patient's debilitating fatigue, restore appetite, diminish pain, remedy nausea, cure vomiting, and curtail down to the bone weight loss. Dr. Scannell concluded by noting, "Almost every sick and dying patient I've ever known who's tried medical marijuana experienced a kinder death."
Hello, Wyatt.
Hello.
What are your views about medical marijuana?
I think that if you're going to treat it as a drug, it should be more regulated. But if you're the simple prospect that it is illegal, and while alcohol and other drugs that people use for the same reasons are legal yet far more harmful, that just doesn't make sense. I think that it should be made completely legal. But if it is going to be prescribed as a drug, it should be regulated more, because I think there's some holes in the system right now that make it kind of corrupt at the moment.
So you think it should be made harder to get a medical card?
I think it should be made entirely legal, but just like a drug, if it's being used for medicinal reasons, it should be regulated more in that respect.
What do you think about medical marijuana?
I think it's ridiculous. All these people getting their cards for like sprained ankle, some minor injury they had back when they were 2 years old. It's ridiculous.
It's a disgrace to all of us hardworking Americans.
Do you think it's too easy or too hard to get a card in Michigan? Do you think it's too easy?
I think it's way too easy. My friend Jeremy, he goes to a different school. He sprained his finger when he was 6 years old, and they gave him a medical card. And it's ridiculous. It's ridiculous.
How do you think of it as an alternative to other drugs and medications that doctors issue currently?
I'll take this one. I think that traditional medicine is better. I think you smoke too much pot, you get the reefer madness. Go crazy.
Think about medical marijuana.
Well, I think it's kind of interesting. During the Prohibition era, They actually had alcohol allowed for medicinal purposes, and I think that's kind of funny because it's echoed in this now era how it's medical marijuana for medicinal purposes. So I think eventually it'll become legal. What time period? Probably a while from now. So I don't know. I don't see any harm in it. I think if you need it, you should use it. My grandma had cancer and was offered the option of using it, and I think she should have. It would have eased a lot of her pain.